Negative RA blood test but still hurting. That doesn't mean you're in the clear. This is what you need to know right now. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about something I see all the time in my clinic. A patient comes in with joint pain and stiffness. Maybe their hands hurt, maybe their knees or shoulders ache. They've already seen a doctor and had blood tests done. The results? Negative for rheumatoid arthritis. So they're told it's probably nothing serious. But here's the thing, just because your RA antibodies are negative doesn't mean you don't have inflammatory arthritis. And waiting too long to treat it can cause damage you cannot undo. In this video, I'm going to explain why negative test result does not mean you're in the clear, why early diagnosis matters, what tests actually do help, and when it's time to see a rheumatologist. This is especially important if you want to catch things early and avoid permanent joint damage. Let's start with the basics. Rheumatoid arthritis, or RA, is a type of inflammatory arthritis. That means your immune system, which normally is there to protect you, starts attacking your joints. It causes pain, swelling, stiffness, and over time, it can lead to joint damage and loss of function. Most people think RA only happens if your blood tests show certain antibodies, like a rheumatoid factor or anti-CCP antibody. But that's not always true. In fact, up to 30% of people with RA long-term will have negative antibody tests. And in fact, in the beginning, 50% of people with new rheumatoid arthritis will be antibody test negative. That's called seronegative RA. And yes, it's real, it's painful, and it can still cause serious joint damage. Here's what seronegative means. It means your blood tests for rheumatoid factor and anti-CCP antibody came back negative, but you still have joint inflammation, symptoms, and changes on imaging that look like rheumatoid arthritis. Some people may think that rheumatoid arthritis is a milder version of RA. That's not always the case. While some studies show it may progress more slowly in some people, others can still develop joint damage just as aggressively. This is why you can't rely only on blood tests alone to rule out inflammatory arthritis. In rheumatology, there's something that we call the window of opportunity. That's the first 3 to 6 months after symptoms start in rheumatoid arthritis, where treatment makes the biggest difference. If you catch inflammatory arthritis, in particular RA, early, and start treatment early, you can prevent long-term damage. But if you wait, that joint damage can develop within the first 6 months and then can become permanent. That's why I get concerned when someone is told your labs are normal, so you're fine. But they're clearly not. Don't let normal blood work alone give you a false sense of security. Most people are familiar with x-rays, but x-rays only show bone changes that happen after joint damage is already there in RA. That means they're often too late to catch early inflammation. That's why I prefer to use musculoskeletal ultrasound and sometimes MRI instead. These tools show joint inflammation before any permanent damage sets in. They help me to see if there's swelling in the joint lining or increased blood flow, signs that inflammation is active. Ultrasound is especially helpful because it's quick, non-invasive, and can be done right in the office. And it's much more sensitive than X-ray for early rheumatoid arthritis. So when should you see a rheumatologist? If you've had joint pain or stiffness for more than 6 weeks, especially in the small joints like the hands, wrists, and feet, you should get evaluated. Even if your primary doctor tells you your labs are fine, if the pain is still there, push for a referral. A rheumatologist has the tools and experience to tell the difference between something mild and something serious. In fact, every week I see patients who are told, you're fine, and we find active inflammation that needs treatment. The key is that we're looking for active inflammation in the joints. Whether that's on exam, and as a rheumatologist you can catch subtle inflammation earlier than other physicians can, or whether that's on ultrasound, where you find very subtle inflammation that doesn't even show up on examination. If you find that sort of inflammation objectively there, that's a sign that you have a developing inflammatory arthritis condition and should be treated. Let's also not forget that rheumatoid arthritis is not the only inflammatory arthritis out there. You could have another condition that doesn't show up on standard RA labs. For example, Psoriatic arthritis often occurs in people with psoriasis, even if the skin condition is mild. Ankylosing spondylitis or axial spondyloarthritis affects the spine and pelvis and can be hard to spot without specialized imaging. Reactive arthritis comes on after an infection. Crystal arthritis, such as gout or pseudogout, can mimic RA as well. And then there's just undifferentiated inflammatory arthritis. This is when your symptoms and findings don't perfectly match any one condition, but we still know inflammation is present. All of these can have negative antibody tests, but still need treatment to prevent joint damage. Let's clear up a few common myths here. Number one, negative labs mean no rheumatoid arthritis. That is not true. As you've seen here, seronegative RA is a real thing. Number two, if it's serious, it'll show up on x-rays. Also false. X-rays miss early changes. We don't want to wait a couple of years before the x-rays actually show changes. We want to catch this earlier on with something like ultrasound or MRI so that we can treat early to prevent those x-ray damage changes from occurring. Number three, it's just aging or wear and tear. Maybe, but if you're stiff in the morning for over 30 minutes and it lasts more than a few weeks, that may not only be normal aging. And again, keep in mind that the treatment for wear and tear arthritis or osteoarthritis is very different than the treatment for rheumatoid arthritis. So to sum up, you can definitely have rheumatoid arthritis even if your RA tests are negative. Seronegative RA and other forms of inflammatory arthritis still can cause real damage in the joints. The earlier you treat it, the better your outcome. And don't rely on x-rays alone. Ultrasound and MRI give much better early information. And lastly, you want to see a rheumatologist if your symptoms are lasting longer than 6 weeks, even if your labs are normal. If you found this helpful, make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. And if you're dealing with joint pain and getting mixed answers, don't wait, get the right evaluation. You can connect with us directly through the website. See you next time and live well.